This video examines the geography of health in Uttar Pradesh. We will explore healthcare accessibility, infrastructural gaps, and service distribution across India's most populous state using 2011 census data and GIS methodologies. Uttar Pradesh presents a significant challenge for healthcare infrastructure. With a population of nearly 200 million and a high density of 829 persons per square kilometer, the state must serve over 97,000 villages and 915 towns. The national blueprint for rural health relies on a pyramid of care. It ranges from sub-centers serving 5,000 people to primary health centers for 30,000, and community health centers designed for larger populations of 120,000. There is a structural disconnect between government health models and census data. While health ministry models focus on strict population tiers for allopathic care, census data provides a broader, geographically precise audit of all facility types, including alternative medicine. To understand the reality, we transformed raw census data into a spatially verified system. This involved digitizing maps, assigning unique codes to facilities, merging census attribute data, and verifying spatial accuracy through rigorous checks. The geographic reality reveals a massive void in rural public health. While there are over 21,000 public facilities, they are highly clustered. In fact, 90.1% of villages have zero public health facilities. Extreme clustering means facilities are stretched far beyond their legal capacity. Because placements are not mutually exclusive, facilities often group together in the same location, leaving vast geographic tracts completely unserved. The private sector does not fill this void. Instead, private providers cluster in specific corridors, leaving massive Nearly 98% of all villages have no private healthcare presence. When combining public and private sectors, the disparity remains clear. Both sectors gravitate toward the same economic hubs, meaning 88.6% of villages have zero access to any formal healthcare facility, whether public or private. Urban environments show higher density, but also suffer from extreme private sector concentration. While urban areas rely heavily on the private sector, there remains a stark contrast in coverage and total deprivation compared to rural regions. Private urban facilities outnumber public ones 14-1, yet they ignore hundreds of smaller towns. This creates a mathematical average that masks the severe spatial inequality and lack of access in smaller census towns. This geographic void has led to an unregulated shadow system. In rural areas, unqualified practitioners outnumber qualified doctors by more than 4-1, highlighting that distance is a primary driver of medical vulnerability. Moving forward, public health policy must look beyond population averages and prioritize terrain-based spatial distribution. By targeting these underserved voids, we can turn data into an evidence-based roadmap for better healthcare access.